Hi folks, I'm Dr. Joshua Stern, a veterinary cardiologist, and this is a step-by-step. We're going to walk practitioners through important veterinary conditions and issues one step at a time, or step by step. In today's video, we're focusing on when and how to assess cats for subclinical cardiomyopathy. This algorithm takes an approach of spectrum of care to that question. We're going to walk through the initial assessments, diagnostic pathways, and practical management strategies that you can employ in your own practice. First, we're going to start with assessing cats for hypertrophic cardiomyopathy and assessing whether cats are at risk for HCM. There are 7 main things that should prompt screening for hypertrophic cardiomyopathy. So when you're listening to a feline patient in practice, if you hear a loud heart murmur that exceeds a grade 3 out of 6, that should prompt you to think of HCM. A 3 out of 6 heart murmur is a heart murmur that's louder than the heart sounds itself and can generally be heard on both sides of the sternum. Another auscultatory finding would be gallop sounds. An S3 or S4 additional heart sound, even if it's intermittent, is never normal in a cat. HCM as a disease can cause ventricular arrhythmias. Advanced HCM can cause atrial fibrillation or supraventricular arrhythmias. So if you hear an arrhythmia on your examination, or if you happen to catch an arrhythmia on an EKG, that should prompt you to screen those patients for hypertrophic cardiomyopathy. Additionally, cats that are going to be bred to produce kittens should be screened for HCM, generally every year, because we know that this is an inherited disease. And as an inherited disease, if there's a family history, that should also prompt you to screen for hypertrophic cardiomyopathy. We're very fortunate in veterinary cardiology that there are at least a few genetic tests. So if you have a purebred cat in front of you for which a genetic test for HCM is available, and it's positive in any way, that should prompt you to want to screen for hypertrophic cardiomyopathy. There's a 1 in 7 chance of a cat having a diagnosis of HCM. But importantly, that risk of being diagnosed with HCM goes up year over year. And so I recommend that you go ahead and screen any cat that has exceeded 6 years of age in practice for hypertrophic cardiomyopathy. Now that we've identified findings that prompt a screening for hypertrophic cardiomyopathy, it's time to move on to diagnostics. We're going to focus on 2 main evaluations, the NT-proBNP and the point-of-care ultrasound. Now, NT-proBNP can be assessed in a number of ways. One of the ways is a qualitative benchtop test or a SNAP test. We're looking to see whether that result is simply positive or simply negative. Now, there are quantitative tests for NT-proBNP available as well. Any elevation would be considered a positive test result. And those numbers may change from analyzer to analyzer. Now, when we move over to the other diagnostic test that's being recommended, that's a point-of-care ultrasound. We know that left atrial enlargement is a feature of HCM as it progresses. And so we're going to be looking for left atrial dilation. So focus on left atrial size, either by left atrium to aortic root ratio, or just a total size of the left atrium in that 4-chamber long axis view. Additionally, I want you to assess for obvious left ventricular hypertrophy. You're going to be making a diastolic measurement of the maximum wall thickness. I'd like you to do it a few times in a few different spots to make sure that you're identifying the thickest segment of the left ventricle at peak diastole. In this video, I'm showing you a cat that has clear left atrial enlargement and a thickened left ventricle. We know that the left ventricle should be less than 6 millimeters in a healthy cat, and left ventricular hypertrophy is considered greater than 6 millimeters when we measure it. This is a still image from the point-of-care ultrasound demonstrating peak diastolic timing where you would measure left ventricular wall thickness. Extreme left ventricular hypertrophy is a measurement that exceeds 9 millimeters. You can see in this image that this cat's left ventricle is very thick, almost a centimeter in diameter during diastole, and certainly consistent with hypertrophic cardiomyopathy. And in this still image from the point of care ultrasound, I've paused when the left atrium is as big as it gets. This is where I'm making my assessment of left atrial size, and this cat clearly has an enlarged left atrium. So finally, we are going to move into the management category and say either yes or no based on the results of our diagnostic findings. If we say yes, we have found some positive results while performing our diagnostic screenings, then cardiomyopathy is likely. HCM is a disease that has what we call phenocopies. Other things that can masquerade as hypertrophic cardiomyopathy can contribute to thickening of the left ventricle or can cause other problems. And so one of the things I want you to do is assess for other systemic diseases. Do a systemic blood pressure. Measure the cat's blood pressure and make sure that systemic hypertension isn't present. I'd also like you to make sure that the cat isn't at risk for hyperthyroidism. And so a total T4 measurement is in order for any cat that you suspect has cardiomyopathy and has an age greater than 6 years. And then finally, anemia can impact the cardiac structure and function in cats. Go ahead and at least get a hematocrit value to make sure that the cat isn't concurrently anemic. After we've completed that assessment for systemic disease, any cat should be referred for an echocardiogram where we have a consideration that cardiomyopathy is likely. From a spectrum of care approach, it's important to recognize that not all cats will be able to go see a veterinary cardiologist and have a complete echocardiogram. That can be for many reasons. In that case, we're going to suggest that these cats be monitored carefully in your practice and undergo a period of what I like to call watchful waiting. We're going to recommend that those cats be reevaluated by point of care ultrasound, perhaps every 6 to 12 months, until such a time that clear, moderate to severe left atrial enlargement is observed. Once you feel really confident that those cats have moderate to severe left atrial enlargement, their left atrial size is clearly exceeding 18 millimeters, or a left atrium to aortic root ratio of 1.8, it's fair to move on and treat those cats as though you're confident that they have hypertrophic cardiomyopathy, even in the absence of a veterinary cardiologist evaluation and a complete echocardiogram. In these patients where you've assessed, no, we have not found anything that suggests cardiomyopathy, we really need to consider whether cardiomyopathy may still develop in the future. Remember, this is an age-related disease, and so in those patients, we recommend that you reevaluate them in about a year by just moving right back up in our algorithm to repeat the NT-proBNP and point-of-care ultrasound assessment. Hypertrophic cardiomyopathy, particularly in its subclinical form, is an incredibly common disease. It's important that you have a real-world approach to screen for this disease in your practice, identify cats that may harbor hypertrophic cardiomyopathy, and understand what your options are for managing this disease. Thank you all for watching this step-by-step, and a special thanks to PRN for sponsoring this edition. For more information, check out vetfolio.com.